Hi everyone, James and Mark here, Radiology Registrars.
We'll put together a really brief video for you to help you identify the key features of coronavirus on chest x-rays. So this is the normal chest radiograph, lovely clear lungs with nice lung markings both sides, and importantly you can see nice and clear in the mid and the lower zones here. You can see those ribs, the posterior part, the lateral part and the anterior part, really nicely, really crisp.
Okay, so moving on now to a classical coronavirus case that we've had. This is a 68-year-old man. And what you can see here is the peripheral patchy consolidation in the mid and lower zones, obscuring those nice rib markings that we saw on the previous x-ray. Now, this is normally always bilateral, so as you can see on the other side, very much the same thing. It's patchy, and it's peripheral.
And unfortunately we see this again and again. Mid, lower zones, peripheral, patchy consolidation.
Of course, a lot of these patients are ending up on ITU, and if you are looking at radiographs from ITU, you need to be thinking about lines and drains. Here we've got a case, we've got the NG tube, which you can see missing the bronchi on either side, heading straight down the midline below the diaphragm where it turns left. A lot of these patients have central lines. Central lines may be in the right or left jugular. Here we've got a left jugular CVC line, just heading into the SVC there. And a lot of the x-rays will be to check ET tube positions. ET tubes can be difficult to find, but we've got an ET tube here, just projecting below the clavicles. Sometimes we're putting subclavian lines in, and these are more visible under the clavicles.
Another case from ITU. So again, the lines are in place, ET tube in situ above the carina. You've got the NG tube in situ going down midline, down below the left side of the diaphragm. You've got a central venous catheter in situ, again left-sided approach, and you've got those classic changes: peripheral, patchy consolidation, mid, lower zones, and also in this poor patient in the upper zone. But this is a few days later, and thankfully this is a good story. The patient is now much better. You can see that peripheral patchy consolidation is much improved from before. This patient's now off HDU, made a full recovery, and we're going to hopefully see this time and time again now. Occasionally it's more subtle. Here there's a bit of sparing of the lower zones, and it's more in the mid zones here, and a bit less confident.
So a few cases for you there. Hope it was useful in picking up some of the key features of coronavirus on chest x-rays.
Good luck and stay safe.